The breast lifting procedure, which is commonly known as mastopexy procedure, is done for the ladies, who has a saggy or ptotic breast. If a lady has a really huge breast, especially during their younger ages, most probably will eventually sag and become ptotic. This is very distressful situation for any kind of woman. So when we are doing our mastopexy procedures, we usually relocate the nipple areola complex of your breast, and it will be located in your breast band in a most uplifted position, which will eventually end up with the scars. The most important aspects of the breast lifting or breast reduction procedures are they result with inevitable scars on your breast bands. If the breast is small and if the lifting that necessary lifting is limited, we can achieve the result with just lollipop shaped, what we called, which is the scar is located around your areola, and also there is a vertical line on your breast tissue. However, as long as we obtain a good breast shapes, the woman doesn't think about the scar tissue that will remain the rest of their lives, too much. The breast reduction procedure is also have the same principles with the breast lifting procedure, because in both operations, the nipple areola complex will be lifted on your breast mounts, and also your breast will be definitely in a smaller shape, but which definitely will be looking more aesthetically pleasant looking. On the other hand, the breast reduction procedure can be regarded as a reconstructive procedure also, because of the weight of the heavy breasts can sometimes to make the breast strap lines over your shoulders, and also it may end up with the back pain or neck pain at the same time. The breast reduction procedure most probably will alleviate these problems, and also during the postoperative period, the patients will be really free of this shoulder, neck, and sometimes back pain. We usually prefer to do this kind of operations after the pregnancy and breastfeeding, because we don't know what kind of saggy or ptotic breast we will have after the pregnancy and breastfeeding. It is best to postpone this kind of surgeries after the pregnancy and breastfeeding. And also sometimes the breast tissue will atrophy and will lose some consistency inside of your breast due to upper part of the breast will empty, and sometimes we have to put some small breast implants, in order to achieve a better upper pole fullness. Well, in general, the mastopexy and the breast reduction procedures are very promising operations for the woman, especially when they have got a baby, and if they think that they would like to have the same breast when they have before their pregnancy, these procedures can be done easily for them, and the postoperative course is really uneventful in the good hands. So if the woman thinks they will be benefited this surgery, we really encourage our patients to have this kind of surgeries.